So I was told not to get bogged down with a lot of the really technical stuff, like the little facts and stuff that you get taught in lectures, and to focus on what's a bit more clinically relevant because that's what they ask you in exams. Be very regular with my study. So maybe have like every Sunday you're going to look over PBL notes or something like that. So just keep to your study every week, and that helps you get through everything.
Someone said to work out your own study method and what works the best for you. And yeah, that's probably the best advice I've got.
I was told before I even started medicine that when I did start it, that I should focus on the basics. So what you're going to encounter every day as a doctor, not the interesting things and the things that you find interesting, but the basics like diabetes, heart failure. And so I found that very helpful because it allowed me to automatically focus every day on what I needed to know as opposed to getting sidetracked by the things that I found more interesting.
Well, I knew that going into medicine there'd be a lot of stuff to learn, so I was encouraged to sort of try and stay on top of things week to week instead of leaving it all to the last minute, and that's really helped.
I got one of the first bits of advice was from Mitch, who said, don't leave all your pancakes until the last few weeks. So he said, medicine's like a big part of pancakes. You can enjoy eating them slowly, one at a time as you go along, but if you leave your giant stack of pancakes until the very end, it's just going to be too much and you'll feel sick and you'll probably throw up everywhere. And that was probably the best bit of information. I did try and ignore it. Doesn't work. Eat your pancakes.
It gets better after foundation block.
Probably the best advice I got was keep up to date week to week. Don't fall behind.
Turn up on clinical days and don't piss off your PBL group.
I really like it when we can, so things like the ILA, or I'm looking forward to the elective next year because those are situations where we can really apply what we've learned. And it doesn't, I don't know, I feel like you're doing less of rote learning and a lot more sort of practical stuff that you're going to be doing in real life later in the future.
I just find it really interesting, and especially when we learn things that I can then relate to something I've seen or experienced.
I think seeing it all pieced together as we've done successive blocks. So, yeah, getting a better understanding of the body as a whole rather than each individual system.
Getting my head around bits that I found really difficult initially and I thought were the most complicated things that I'd ever encountered in my life, and coming back to them a couple of months later and realising that there were maybe 3 components and I get it, which is just, it's really rewarding. Thank God.
I probably enjoy most of the clinical days, certainly being able to use what you've learnt in the lecture theatre and in the laboratory in real life, and actually ask a patient these questions and get to see them in a clinical setting is pretty amazing.
Being involved in the hospital a lot has been great, and seeing the practical applications of knowledge is fantastic, and the ability to explore your interests, that sort of thing.
So the thing I've enjoyed most is learning really interesting things. There are some really interesting concepts that people teach you, and you get such good opportunities to hear from really amazing people. The guest lecturers are often quite good. Some of them are really bad, but often they're really, really good.
Clinical days are good fun. They're a lot better than going to lecture theatres, so 3rd and 4th year will be awesome. Probably because you just get to apply everything and stick things with needles and do all the fun stuff.
What part of I hated? Fire hose learning. So just the sheer amount of content in the small amount of time we're given to learn it.
The least would be just the speed that it all goes at, because there's just a huge amount of information, and what you get in the lectures it scratches the surface. Like, they're massive, massive topics, and you don't have time to really saturate yourself and engage with them.
I guess just because the pace is so fast and it's so much information, often you can't take the time to be interested and enjoy something. You just have to try and learn it and move on to the next thing.
Probably studying anatomy. I really enjoy it when I know it, but I find the process of studying it really hard.
Basically, it's a very busy degree, and it's always sort of in your head. You can't really get away from it. Whether you're at lectures or not, it sort of feels like there's this pressure to keep studying and to do lots of work, and that's been hard. Sort of feeling the obligation to study a lot, even outside of studying, has been difficult.
I'd probably have to say infectious disease or pharmacology, because you have to remember a lot of stuff, and it's not really like understanding, it's more remembering that naltrexone's different to naloxone, which is different to naproxen.
Probably pharmacology. I find it really hard to get all the drug names down and what they do, etc., etc. So it's a lot of rote learning, and I'm not too great at that.
Probably the population medicine stuff, honestly. And dealing with it was just finding a way of thinking about it that worked for me, finding a way that wasn't just memorise lists of epidemiology, etc.
Immunology's hard. Yeah, probably immunology. Why? I guess it's just really complicated and lots of sort of weird names and stuff to learn. Same with microbiology. I feel like I want to get my head around it, and it's not that hard, but I just haven't given it enough time to do that.
Infectious diseases. I found really hard to remember the names of everything.
Infectious diseases. It was the hardest because I'm not the best at rote learning things, and I feel that infectious diseases are primarily rote learning. However, you can get around that by just spending more time on it.
Probably the neuro one, which you have at the beginning of your second year.
Cardio.
Neurology, without a doubt.
Probably for me, respiratory, because I kept thinking it was fine and I got it, and then I'd realise I was totally confused and I didn't get it at all.
Neurology.
I think probably foundation was really hard, but of the ones that I sort of consider the interesting blocks, probably musculoskeletal was the hardest.
I found neurology the hardest.
For me, I don't know if it was the hardest block per se, but I found cardio and resp the hardest because I wasn't yet in the rhythm of study and I didn't have a science background, and they completely threw me. I had no idea what I was doing, but it's better now.
Maybe 2 to 3 on weekdays, and maybe like 5 or 6 on each weekend day.
On average, I'd probably do about an hour per weekday. That varies a lot. On weekends, I don't do a lot of study. Like weekends leading up to exams, I will. But normal weekends, maybe 1 or 2 hours.
Probably on a good weekday about 2 hours, but that can vary from anything to down to nothing. On weekends, depending on what I'm doing on the weekend, it might be 2 hours per day, or it might be 5 hours a day.
I would probably study minimum 2 hours. It might not necessarily be intense study. It might just be a little bit of light study. On the weekends, I don't really study except in the lead up to exams, where I would happily do, maybe 7-8 hours a day on the weekends.
Embarrassingly, certainly not enough on weekdays, and probably not enough on weekends either. I'd say 1 to 2 hours outside of exam periods on weekdays, and 2 to 3 on the weekends, and then closer to exams, maybe 4 or 5 on weekdays, and I try to get 6 to 8 done on the weekends.
Weekdays, probably 3 to 4 on average. Weekends, about the same most of the year. Coming up to exams, I tend to do an entire day. It'd be about 8 to 10 hours.
Initially about 2 or 3 hours a day, and about maybe 4 hours a day in the weekend if I felt up to it.
Maybe 2 hours every couple of days, weekdays, and then weekends maybe 3 hours, like over 2 days. Old school, I have a ratty piece of paper and write what doesn't make sense. I've seen so many laptops fall over in Footbridge, I'm not going to bring mine in.
I write them down on a piece of paper. I've tried to print off the lecture slides, but you just end up with large volumes of lecture slides.
On paper, just like a notebook. I think the first couple of weeks I used my computer, but I got sick of carrying it around, and I actually like writing things by hand.
Usually with printing out the lecture slides and then annotating those, but always with paper, yeah.
I take all my notes on a laptop. I download the PowerPoint and then just write on that. I started off by printing out all the lecture slides and then writing on them, but then it just got to be too much and I started bringing my laptop in, and it was easier to keep everything organized as well.
For a long time, I was avidly all about the pen and paper, and I found that really worked for me, but it just got a little bit slow, and so recently I've started taking notes on my computer.
I annotate the PDF on an iPad.
Well, what hasn't changed is that I continue writing notes for every week. But what has changed is the volume that I write. So I start off by trying to get everything, explanations for everything, and I can't learn all of that, and I used to get really stressed out. So now I've started limiting my notes to what's more clinically relevant, and that really helps.
I'm kind of changing them all the time, to be honest. My new approach as of this week is that I won't put as much emphasis on the lectures, and I'll try and look at other resources like best practice and the USMLE book to get other different synthesis of things. I think that works better for me, looking at a few different resources and looking at things that are that summarize or show the information in a different way.
The biggest change I've done is I now religiously try and take notes for every single lecture, even if I don't ever go back over those notes. At least it's in my brain once.
I have changed my study methods slightly, so I tend to write notes and then rewrite notes and then write quick notes. That's remained. However, what I have changed is what I'm basing my notes off. So I started the first year off by primarily using lectures and going over those again, and kind of ignoring the peripheral resources such as textbooks and learning topics and whatnot. But I've since incorporated those into my study habits, which I think has benefited me greatly.
Learning lectures, I've always been. I've always just taken notes on the lecture notes, but I tried flashcards for a little while rather than lecture notes. Didn't work out for me.
I read more textbooks because it gives you sort of a broader understanding, which hopefully you'll be able to apply when you're an intern. I've never watched a lecture online, and I never plan to.
Right now, I tend to sit at home and watch all the lectures online. I used to attend all the lectures, but I changed from that because I found that I was just getting too distracted in the lectures, and I have a tendency of falling asleep a lot. So it works out better for me when I'm at home. And I can watch things on double speed, which also makes me get through things quicker.
I usually go to the lectures, occasionally online if I miss them, because I'm really lazy, and if I don't actually go to class, then I feel like there's a fair chance I won't ever do it, basically.
I attend all the lectures. Why? Because I find it hard to concentrate when I'm at home if I listen to it on a computer, and I just like being there. I feel, just the concentration is much easier if I'm there in person.
I do a bit of both. I used to go to all the lectures, but I've realised that if I study them at home and if I do them online, I can be far more effective. I can watch a full day's lectures by, say, midday, and then I've got the rest of the day to study and revise them. So it's so much more efficient to do them at home.
I try to attend the lectures, and so far I have. Why? Because I feel that I learn best in an environment where there's an actual lecturer there, as opposed to trying to look at them through a computer screen.
No.
No.
No, never read them in my life.
No.
No. There were a few weeks in first year that I looked at them and was trying to make notes, but there was just too many, and it was sort of the way they were structured, it didn't seem useful at all.
Not closely, but I always read them.
Yes, I do participate in a study group, and I really find that it's very helpful because it keeps you, it sort of forces you to keep up to date every week because you have to write notes to be able to contribute something to the study group or you feel very foolish. But also it helps in understanding concepts that you didn't realize you didn't know. We have it in our study group. We'll read off our notes to each other, and then somebody will be like, wait, I don't quite get that. And that really helps you figure out whether you know something or not.
The only thing I really do in terms of study group is once a week, me and another girl meet up and do anatomy stuff, just kind of talking through and quizzing each other. And I studied with a friend before the last exam, and that was helpful. They're both very helpful, actually.
Not a study group per se, but in the lead up to exams, there's a bunch of people that are always in the med lab, and you see them every day, and you study a lot with them for a few hours every day. And every now and then I'll meet up with some friends and study, but nothing strict.
Yes, I started to participate in a study group halfway through the first year, and I found my understanding of the subject matter significantly improved from then on.
Yes, occasionally. The clinical one's really good because you get to sort of study for OSCEs, which you'll love in the end of second year. Other stuff I seem to learn better on my own, but it is good sort of 5 weeks before an exam to meet up with people and see what their level of knowledge is and whether you should freak out or not.
Just make sure you look the part, because it's all about, I guess a lot of it is about presenting an image and looking confident and comfortable in front of the patients. And if you look shabby, you ain't going to do that.
Take everything in. I mean, you get 1 day a week in the first 2 years, and it's easily, for me at least, the best resource that I had to try and round everything up. So that's what you're going to be doing. So, make the most of it. And it's also important to dress up, have a shave, probably shower would be a good idea. I mean, it's mainly old people that you're seeing in the hospital, and that's what they expect. They expect you to look like a doctor. So that's what you have to come dressed as.
Get involved early. Everyone says it, and no one does, but start going up, find a friend, go up to the wards, talk to patients, do exams as much as you can. Use your whole day at hospital.
Dress well, be nice to old people, and be nice, very nice to nurses. 'Cause if you don't like a doctor and you hear heaps of people whinging about them, it's probably not actually that bad because you get something out of everyone. And the old school guys are always racist and hilarious, but they know their stuff really well. And the young guys are really good because they'll tell you exactly what you need to know for exams and stuff like that.
I find it's quite a good way to actually learn stuff properly, because if I see a patient that's got such and such a disease or symptoms, then that's usually how I'll actually remember it.
Don't be afraid of looking stupid, because it does happen a lot. You don't know everything, and you will get pulled up by your supervisor or your other group mates, and that's okay. It's all a learning experience. So I have a 6-box system. I divide my page into 6 different boxes, and then each box has a different heading in it. So presenting history, management, social history, and so forth. And that just keeps you on track and makes sure that you ask all the questions that you need to. And at the very top of the page, you always have the same things written down. So that's name, age, and profession. And within some of the boxes, you'll have certain things that are always there. So like allergies, never forget to ask about allergies. And depending on what history you're taking, so if it's cardio, in each box you'll have certain things that you have to ask.
I think the most important thing is just to try and get on with the person. So pretend it's an older person that you're meeting for some reason, and just be polite and have a bit of a conversation. Pretend like you're actually interested in them, and then the rest is fairly easy.
Just be nice. I mean, a lot of the people that you're going to meet, especially in the first few years, are really, really lovely people, and they just want to chat, and they're happy to chat. And so just do it and just relax. I mean, you don't need to rush through it. Just take your time and chat to them. It's good.
Try and get some sort of rubric sorted out early on. That's, I think, was certainly my major pitfall, was sitting there struggling and saying, oh, crap, Socrates, I've got this C down. So if you can sort that out early, I think, because all your histories are going to follow a similar sort of pattern. If you can sort that out, it should serve you well for at least the first 2 years.
Get comfortable. A lot of taking history is about getting on with the person that you're talking to. So, and that's just as important as knowing what to ask, is knowing how to ask the question. So spend as much time on the wards as you can and get comfortable talking to people.
I got told by a doctor in first year that you get a piece of paper in front of you, divide it into 6 things, and put your history presenting illness, your like 6 main headings down. And as long as you put something in each box, you'll always remember to ask all the questions.
I would suggest that it's really important not just to go with the lectures, like I tried to do. It's really important that when you're studying week to week, you get external resources from textbooks and from, all the great resources online, for example, just to supplement the lectures, because the lectures aren't the be-all and end-all for what you're going to learn. You need a much more holistic thing.
Study consistently. Don't leave it all till just before the exam. Yeah, study, make your own notes.
I think time management is pretty important for this course. There's a lot of stuff to learn in 4 years, and so you're the one that has to try and sort that out. That no one's going to do too many favors in that department.
I would say get into a study timetable that works for you. Like, find out how much work you're able to do week to week, because you want to be consistent. It's no use doing nothing and then freaking out right before exams. Find what works for you and that you can maintain the whole way through.
General advice for someone first starting would probably be study earlier rather than later. And if you see things that you don't understand but other people do, it's probably not worth understanding. If it's some like molecular piece of information that doesn't really make sense, you won't need it later on, so there's no point knowing it now.
Definitely to not stress out too much, and it's meant to be hard and you're meant to feel overwhelmed, and everyone does. So just try to enjoy it, and same as what I learnt is work out what works for you in terms of studying, and don't worry if it's different to other people. Just try and stick to that, but make sure you're still enjoying life is a huge one.
Don't be too overwhelmed. It's hard being around lots of really high achieving, accomplished people who are really talented, but don't be deterred, because you've got into a really good course and you are amazing of your own merit.